All right, we're back. We're talking about hip pain. Last video we talked about osteoarthritis of the hip. And to summarize, we really were talking about how there's many other things that can cause hip pain besides osteoarthritis. We know that hip replacements are on the rise, 150% in the last 10 years. We know that the main reason that somebody gets a hip replacement is because they get an x-ray that shows that they have joint space narrowing or bone on bone. And we also know that research shows that 70% of people over the age of 70 have an image that shows joint space narrowing, but only half have pain. So that is not a good indicator to replace somebody's hip. Let's talk about the 5 other reasons why somebody could have hip pain. Number 1 is what's called hip bursitis. And if we go back to our anatomy app here, this is the connective tissue, and these little circles right here, these little kind of oblong circles around the hip are called bursas. What a bursa is a fluid-filled sac. And the fluid-filled sac is a structure that's designed to help with tendons. When they attach to the bone, the tendon needs lubrication. So this is a big bursa right here. This is called the greater trochanteric bursa. And when bursitis happens, that means that that fluid-filled sac has gotten inflamed and larger, which can be very painful. As a tendon comes over the bone and attaches to the bone, it allows there to be lubrication between the tendon and the bone so that the tendon does not fray over time. And bursitis is inflammation of that structure, which can then cause pressure, and then the nerves become painful. Nerves become sending signals to the brain. Bursitis is a friction or movement disorder that is absolutely fixed by physical therapists, and the goal there is to just reduce the stress. And if you look at the muscle, so here's a good one. Here's an anterior hip bursa, and if I add this muscle, this is called the iliacus, or the iliopsoas muscle, the hip flexor. This comes down, and you can see underneath this where this starts to rub on the hip capsule in the bone. There's a bursa in there, and that's designed to give the hip flexor lubrication. If I go over to this part, this greater trochanter, and if I add on the glute right here, the glute medius, this should actually extend over this, but you can see that the glute medius, the big butt muscle, goes over the bursa to cause lubrication between the tendon and the bone. And so that's one cause. The second cause, top cause of hip pain, we had number 1 is bursitis. I'm going to check my notes here because I had, now we've got tendinitis. And sorry, I had a list here that I wanted to cover. Tendinitis is, again, we'll go back to our hip flexor, and you can see that this muscle turned into a white tendon, and the tendon attaches to the bone. This is such a cool muscle. See how it comes to the inside. Has lots of effect on the hip rotation and extension. This is a muscle that gets really, really affected by how much we sit. Really, really common for somebody to have hip pain or low back pain because of this muscle. But back to tendinitis. If this tendon starts to get rubbing against the bone or gets too much stress, it becomes inflamed and can be very painful, usually at the insertion site of the tendon. So we get inflammation and tendinitis. That can happen on it can happen here in the groin, it can happen back here, it can happen to any muscle around the hip. Any tendon that attaches to the actual bone can become inflamed. So you can see that there's lots and lots of possibilities here for what can be causing tendinitis and where the tendinitis is. Now, tendinitis is basically a stress response. The tendon is overloaded, and so again, the physical therapy strategy is every muscle works not in isolation, but with a team of other muscles. So the goal to reduce tendinitis is to bring in other muscles around the body that do the same motion, the motion that's painful, and then we reduce the stress from that tendon. Or you could look at it from those muscles may be weak. The other muscles that are helping out might be weak, but they also might be tight. And if a muscle is tight, oftentimes it can't function very well to help decelerate the forces that tendon has to deal with. So tendinitis was number 2, and sciatica or referred pain is going to be number 3. Let's talk about that. So if I get rid of my muscles, now how can sciatica cause hip pain? Well, that would be in the category of what's called referred pain. And so I'm going to give you an image here of the nerves that go down, and we're going to zoom out a little bit here. Zoom out, and we're going to pan down. See if I can figure out this. Okay, so you see here, lots of nerves. Wow, that's amazing. Isn't it amazing? What I really want to pay attention to is this nerve right here. I'm going to go back, and I want to be able to zoom out. Okay, so you can see this big nerve right here. This is called the sciatic nerve, okay? And the sciatic nerve travels all the way down the back of the hip, down the leg, into the foot. And if you trace the origin of the sciatic nerve, you can see that the origin of the sciatic nerve actually, if I look back here, comes all the way from the low back here. You can see that these little nerve roots that come out of the spine, they all come together. The last 5 segments of the spine, they make this big sciatic nerve. So I can absolutely have hip pain right next to the joint, and it can be because of my back. I can tell you that I've had, oh gosh, in the last 7 years, I've probably had 200 patients that have had hip pain. They got their hip replaced. Their hip is still hurting because it wasn't their hip. Now, that's a terrible thing. So, again, sciatica, there are tests that you can do to rule out sciatic pain or hip pain to determine which one it is. Okay, now moving on. Muscle strain. A muscle strain is definitely very common. Muscle strains are basically, the definition of a strain is the muscles around the hip. Any muscle around the hip can become micro-torn, little micro-tears, which is called a strain. That can be because of a movement or something you did that caused a little muscle strain. And you overloaded the muscle. Now it's torn, it needs to heal, and it's painful, typically 4 to 6 weeks. And then the final cause is what we talked about before, is hip arthritis. That's absolutely one of the top 5 causes of hip pain. But my point is that there's many other reasons why somebody can have hip pain. It's important to rule those things out before jumping the gun. And you rule those out by seeing your doctor or your physical therapist, getting assessments, trying conservative treatments. And the next video, it'll be the last one of the month, and we're going to be talking about the top 3 strategies on how to relieve hip pain and optimize motion. And again, just a reminder, this month we are definitely offering all of our friends and family from Superior the opportunity, there's 10 spaces for a free hip movement screen to determine if what's causing your hip pain are treatable by physical therapy, or if you need to have hip surgery. We're definitely here for you. If you've been out there and you've gotten a diagnosis of hip osteoarthritis, bone on bone, and you've been told you need a hip replacement, I would still encourage you to come and see the movement experts, the musculoskeletal experts, which are physical therapists. We'd love to take a look at you. Hope you're doing well, and talk soon.